Hello, and how are you? My name is Winnie Barawa, and if you're new here, welcome to Medic Academy. And if you're a person who's coming back and have been part of us, today we are going to discuss gender issues that are affecting health. And without wasting much time, let's go in and hear what we've prepared for the day. Hello, and how are you? My name is Winnie Barawa, and if you're new here, welcome to Medic Academy. And if you're a person who's coming back and have been part of us, today we are going to discuss gender issues that are affecting health. And without wasting much time, let's go in and hear what we've prepared for the day. So, the first gender issue that could influence our health is poverty and economic imbalance. But what is in this about poverty? It's being said that poverty is where there is lack of access to benefits or different aspects of our lives, and this could include issues such as benefits or wages. Now, when it comes to gender, remember we are referring to existence of men or women, and here we are looking at the imbalances that can affect our health, or the issues can lead to health determinants and issues affecting its distribution. So, for example, we are being told that women are more likely to be poor compared to men because of the culture and beliefs and even structurally discrimination that is existing. So, women are told are more accounted to create to give the biggest percentage when it comes to the elderly poor at a rate of around 64%. So with the gender issues, you find poverty mostly is like on the leading side, then followed by culture issues. So due to the economic imbalance, it's being said that more women or more men are not able to access all these major services. For example, access to health services. And so because of that, their health may a bit be affected, or looking issues like access to medical insurance. So you find if certain genders are not able to access these main resources for access to health, then it becomes a problem and a risk factor for health issues. And the second issue that can affect our health is education. So in cases where it's being said that people are not able to access good education or quality education, then there's involvement or risk of early pregnancies, for instance, in the women, and then there's an issue of of dropouts among the men. So because of these issues, they say if there's quality education among women and men, then people can go to school or they can attend school longer. And because of this, also the fertility, levels also tends to go down. And as this happens, more women are able to access, income, they're able to access jobs. And because of this, their life gets better and their health status also improves. Unlike whereby maybe women get pregnant early, they drop out of school, there's no source of income, maybe because of the challenges, and they're not able to go back to school, such as cases where some systems still don't allow pregnant women and girls going back to school. So you find that if education is not prioritized, then there's a high risk that the health system of a country may also go down. Because if a person is not well educated, they're not well informed, there's no exposure, holding an importance to issues like health also is a little bit very not considered that much. So people like they just appreciate that they're existing, but they don't prioritize a lot of issues, and a lot of it may include even their health status or their health issues. And the other issue includes culture and norms. So, with culture and norms simply involves systems that we believe in, our religion, our beliefs, traditions, or even the marital lines. Now, culture and norms could be good and bad based on how we apply it. And it's being said that mostly the ones that bring a lot of danger to our health are the harmful gender norms or the harmful cultural beliefs. For example, in communities that still believe in female genital mutilation or female genital cut, that's a medical risk that can lead to injuries, infection, and long-term side effects. But also, you need to appreciate there are still cultures that believe in encouraging men and boys in taking health risks and very limiting health-seeking behaviors, like maybe withholding, their right to access health services, or religion hindering people from going to hospitals and such. There's also behaviors like wife inheritance, which can lead to high risk of transmission both of HIV and AIDS and other sex-transmitted infections. So culture is good, but also culture is not favorable based on the beliefs and the practices that are being incorporated in that particular community or in the people believing in it. And then the other is access to healthcare information. Information is power. And I tend to believe if you know more about health, then you become more knowledgeable and you become more competent even into how to engage into it and make health decisions. However, lack of the health information about certain conditions and treatment lowers our perception and the need for urgency when it comes to seeking healthcare services. It's like telling someone you need to be checked on cervical cancer and they have no idea what cervical cancer is. So if you need more people to be more keen and involved with their health status, it's good you allow them to access health information and allow them to understand what the different aspects or components of healthcare are involved. Closing up in gender-based violence. So with gender-based violence, we simply mean in a state whereby someone uses power to incorporate their wishes on person against their own will, where you use your power to force your wishes on another person without or against their will. So with gender-based violence, it's being said that there's high risk of mortalities due to it, and more so it happens a lot around female or the female gender, with a little percentage affecting or spilling over to the male gender. So the effects of gender-based violence are very many. Part of it is health related, although you can also have other complications coming from gender-based violence, like issues of social complications, economic issues, and so on. By focusing on the health effects that gender-based violence can bring, GBV can lead into injury, GBV can bring unintended pregnancies. GBV can lead to pregnancy complications, sexually transmitted infections, HIV included, could be depression, PTSD, even death in the worst case scenarios. And the last part is power imbalance, especially in the household areas where maybe certain genders are not allowed to make certain decisions regarding their health, either because they are seen as either men or women. And for this purpose, their access to health is limited. So if you like content like the ones I'm sharing today, you can comment and subscribe to our channel so that you can enjoy more about us. Thank you and see you in our next class.